The Laundering, Volume 2, Case 10. The process is the filter. A back-office software system, 3 failed rollouts, $250 million, and healthcare workers who have not been paid for weeks at a time. The Saskatchewan public account renders this as a difficult modernization. It is not. Open the case.
It is a hiring failure that produced a technology failure, and the modernization vocabulary launders the staffing root cause. The same institution running this rollout is the institution that hired the people running it. Both facts are downstream of one decision architecture.
Walk it. The chronology.
The Saskatchewan Health Authority began work on the Administrative Information Management System with an initial budget of approximately $86 million. AIMS was scheduled to go live in May 2021. The launch slipped to November 2022. The November 2022 launch was aborted after a few days in the public characterization of the President of the Saskatchewan Union of Nurses due to widespread functionality errors. The system was reintroduced in phases starting June 2024. The first payroll run under the reintroduced system on the 5th of July 2024 produced documented, missed, and incomplete payments.
And the third rollout.
A scheduling phase was rolled out in September 2025. By October 2025, the scheduling phase had caused enough operational damage. Workers unable to pick up shifts, healthcare facilities understaffed, pay errors continuing, that the province of Saskatchewan ordered the Saskatchewan Health Authority to cancel the AIMS scheduling component and revert to the legacy system it was meant to replace. The reversion is to be complete by the 30th of November 2025.
And the cost.
Cumulative spending, as of the most recent reporting, is approximately $250 million. The provincial auditor of Saskatchewan had projected the total at $240 million in 2023, nearly triple the initial budget. The system's payroll, supply chain, finance, and human resources components, used by approximately 50,000 employees, remain in use, with the Saskatchewan Health Authority stating they remain stable. The scheduling component, the one most visible to frontline workers and most directly affecting their ability to be paid for the hours they work, has been removed from service. This is what a $250 million project looks like when it does not work.
What the workers experienced.
The public record on the human impact of AIMS is extensive and sourced to 4 major healthcare unions: the Canadian Union of Public Employees, the Service Employees International Union West, the Saskatchewan Union of Nurses, and the Saskatchewan Government and General Employees Union.
What workers reported.
Healthcare workers have reported through their unions on the public record the following: not being paid for periods of up to 5 weeks, being paid less than they were owed, being paid at incorrect rates, physician invoices delayed during transition, inability to pick up scheduled shifts because the system would not register them, missed shifts producing staffing gaps in care facilities, and the cumulative financial pressure of these failures on workers who, in the words of one union president, are unable to pay their bills, unable to make ends meet, stressed out that they might lose their cars, even their homes.
And the institutional response.
The institutional response across the rollout period followed a stable pattern. The Saskatchewan Health Authority initially characterized the rollout as a success overall. After widespread reporting and union mobilization, the SHA's CEO, Andrew Will, issued a public apology in August 2024, acknowledging impacts on staff. after the scheduling phase failures became impossible to absorb in late October 2025, the responsible minister, Jeremy Cockrell, acknowledged that the errors were unacceptable. The arc, in public language terms, is success, then impacts, then unacceptable. And each step was a response to mounting evidence the institution had been told about earlier and chosen to characterize differently. The information had been available the whole time. The characterization lagged the information.
The structural diffusion of responsibility. When asked who is responsible for AIMS, the institutional answer routes the question through at least 3 doors. The Saskatchewan Health Authority is the user community. AIMS is its people who cannot be paid. The SHA is also the public face of the failure, the CEO who apologizes, the staff who absorb the consequences, the operational fallout that lands on its facilities. And the second door.
3S Health is the shared services organization that administers payroll for the Saskatchewan health system. AIMS is described in its own project documentation as a joint initiative between SHA and 3S Health. The technical execution of the payroll function, the part that has most visibly failed, is in 3S Health's hands.
And the third.
Sask Builds and Procurement is the ministry responsible for centrally monitoring IT projects across most of the government of Saskatchewan, per the Provincial Auditor's 2025 audit of that ministry's IT project monitoring function. The broader provincial IT modernization pattern, of which AIMS is one instance, falls under the kind of central oversight the auditor's report examined.
3 institutional homes.
Each can, with technical accuracy, indicate that the failure is not entirely theirs. The user community owns the consequences. The shared services organization owns the execution. The procurement ministry owns the central monitoring framework. No single institution owns the project end to end, and the institutional architecture is what permits the project, after 3 failed rollouts and $250 million, to produce no terminal accountability for any specific senior figure. Responsibility diffused across 3 doors is responsibility nowhere. This is the accountability layer of the laundering. Modernization projects of this scale in jurisdictions with single accountable party structures produce, when they fail, the departure of the senior figure responsible. Modernization projects, routed through 3-way joint structures, produce ministerial statements that the errors are unacceptable, followed by apology, followed by the project continuing in its remaining usable components, with the senior figures remaining in post. The architecture made this outcome available. The institutions used the architecture as it was designed to be used.
The auditor's parallel finding.
In December 2025, 6 weeks after the scheduling phase cancellation, the Provincial Auditor of Saskatchewan released the 2025 report, Volume 2. The report's chapter on Sask Builds and Procurement, monitoring the implementation of IT projects, examined how the Central Oversight Ministry monitors IT projects across most of the government of Saskatchewan.
The findings.
Between April 2024 and March 2025, the ministry monitored 20 IT projects with a combined forecast of approximately $40 million. 8 of those projects ended over budget. 12 were delivered late. The auditor identified one named example in which a client spent more than $4 million on a project before it was cancelled due to the vendor's inability to meet the client's requirements. 5 recommendations were issued, including a finding that the ministry did not assess completeness of client-reported risks or consider the appropriateness of clients' risk mitigation plans.
And the parallel project.
The same volume reported, in passing, that the Enterprise Business Modernization Project, a separate, parallel government-wide back-office IT initiative, was projected at $260 million to fully implement, following a $130 million budget overrun and a 2.5-year delay as of the 31st of March, 2025. AIMS is approximately $250 million and has just had its scheduling component cancelled. EBMP is approximately $260 million projected and is 2.5 years late. The two projects together, EBMP AIMS, as Saskatchewan editorial reporter Tammy Robert has paired them, are approximately $500 million of attempted back-office IT modernization, both running through the same provincial procurement architecture, both producing the same outcome at different speeds.
And the question this raises:
if a single fiscal year's worth of centrally monitored IT projects produces a 60% over-budget rate and a 60% late delivery rate, the issue is not this particular project's challenges. The issue is the capability of the institution to execute IT projects at all.
the process is the filter.
A capable institution does not produce 8 of 20 IT projects over budget in a single year. A capable institution does not run a $250 million back-office system through 3 failed launches across 3 years, with healthcare workers unpaid in the interim. A capable institution does not, when asked, root the question of accountability across 3 institutional homes and produce no terminal consequences for any senior figure.
These outcomes are not random.
And they are not bad luck. They are produced by the institutional capability that exists in the rooms where the decisions are made. And institutional capability is downstream of one thing: who is in the room. Who is in the room is downstream of one thing: who was hired into the room, who stayed, and who left.
The hiring filter.
Saskatchewan public institutions and the provincial crown corporations and provincial government ministries adjacent to them have spent 2 decades running hiring processes that filter for tolerance of institutional process rather than for capability to deliver. The procedural treatment a senior architect receives in a Saskatchewan public sector competition is in many cases indistinguishable from the procedural treatment a co-op student receives. The forms are the same. The competency by numbers scoring is the same. The interview panels are the same. The presumption that the process is neutral and the candidate must absorb whatever the process delivers is the same. The process is the filter, and what it filters out is the candidate with the option to walk away, which is, by definition, the senior, capable, mobile candidate who is most needed in the room.
And the long-run effect.
Institutions that run these processes for 2 decades end up with staffing populations selected for tolerance of the process. The people who remain are, by definition, the people who, faced with the same procedural treatment given to junior candidates, did not walk. Some of these people are highly capable, many are not. The aggregate effect on the institution's ability to execute complex projects, the kind of projects that require senior judgment, vendor management capability, the willingness to push back on a procurement decision that is not going to work, is corrosive at scale and invisible turn by turn. The institution does not know what it has filtered out because the filtered out candidates do not show up in its reports. AIMS is what an institution staffed in this way produces when it attempts a back-office modernization. EBMP is what the same staffing pattern produces in the adjacent provincial ministry. The provincial auditor's 20 projects in a year finding is what the same staffing pattern produces in aggregate. The hiring architecture is the upstream cause. The modernization catastrophes are the downstream symptoms. The public account treats the symptoms as the problem and the cause as a separate question. They are not separate. They are the same operation.
The same pattern at the bedside.
The hiring architecture argument, advanced in the preceding section, operates at the level of structural inference. The catastrophic IT rollout is evidence that capable senior staff are not in the decision rooms. The argument is sound, but it is at that level inferential. The Provincial Auditor of Saskatchewan has examined the same hiring and retention architecture at a different level of the same institution and found exactly the pattern the inference predicts.
The 2022 findings.
In December 2022, the Provincial Auditor published Chapter 12 of the 2022 report, Volume 2, SHA Needs Targeted Plans to Fill and Retain Hard-to-Recruit Healthcare Positions. The SHA identified 31 positions as hard to recruit. The overall vacancy rate, as of the 31st of March 2022, was 5.1%, approximately 2,000 unfilled positions. The 5-year forecast shortage was 2,200 workers, including 840 continuing care assistants, 520 registered nurses, and 180 medical laboratory technicians. The auditor's framing. Emergency rooms and lab services were unavailable to Saskatchewan residents because the institution did not have the staff to deliver them.
In the follow-up.
In December 2025, the Provincial Auditor published Chapter 24 of the 2025 report, Volume 2, the follow-up review of those recommendations. The finding: 3 of the 7 had been fully implemented. 4 remained outstanding. The 4 outstanding are the structurally significant ones. The SHA had not yet assessed which facility locations were most likely to have shortages. It had not considered the root causes. It had not developed targets for performance measures in its First Nations and Métis recruitment and retention plan. And it had not analyzed staff exit surveys to inform retention. The auditor's chronic vacancy rate measure was at or above the SHA's own 5% target in June 2022 and June 2023 and June 2024. 3 consecutive years of failure to hit the institution's own target.
And the auditor's own framing.
Tara Clement, the Provincial Auditor, characterized it directly in December 2022. They're not figuring out why people aren't staying. And, on the rural and remote dimension, what do they need to do to get people to want to work in rural and remote Saskatchewan? The questions, 3 years later, are still open. The exit survey analysis that would identify the root causes of staff departure, the analysis that would tell the institution why it cannot retain the people it hires, remains, as of December 2025, unimplemented.
The institution can hire.
The SHA's CEO reported in December 2025 a 56% reduction in chronic nursing vacancies between September 2023 and September 2025, and a 64% reduction in rural and northern chronic nursing vacancies in the same period, attributing the improvement to new graduate training and recruitment of nurses from outside Canada. The numbers are real. The improvement on the single metric is real. But the understanding of why people leave is not a number on a dashboard. It is the structural question the dashboard cannot answer.
What the dashboard cannot answer.
An institution that improves hiring without ever asking why it loses people, runs a recruitment apparatus disconnected from retention. New hires arrive. The institution does not ask why prior hires left. The same conditions continue to operate. The new hires, in time, depart for the same reasons. The annual cycle resets. The replacement rate is the metric. The retention question is the one the institution has, by its own documented behavior over 3 years, declined to ask.
And the connection back to the IT capability level.
This is the architectural pattern made directly visible by the auditor at the bedside workforce level. At the senior IT capability level, the same architecture is necessarily inferred from outcomes. The failed rollouts, the cost overruns, the diffused accountability, because the IT capability decisions are not directly audited. But the same architecture makes both decisions. The institution that has not asked why its nurses leave is the institution that on AIMS did not ask whether the vendor was producing the capability the institution needed. The auditor's bedside level finding is the evidence the Section 5 inference no longer needs to make on its own.
What this case does not claim, the discipline.
It does not claim that any specific senior official at the Saskatchewan Health Authority, Threes Health, or Sask Builds and Procurement acted in bad faith. The structural argument does not require the bad faith claim. The institution's culture is what produced the outcome. The individuals within it are the institution's products, not its authors. It does not claim that the Threes Health or SHA workforce as a whole is incompetent. The systems that run, when they run, are run by people who deserve credit for the parts that work. The failure is the institution's, not the staff's. The staff are the ones absorbing the cost of the failure most directly through the very pay errors the case documents. It does not claim that AIMS or EBMP can be specifically traced to one identifiable hiring decision. The hiring architecture argument operates at the level of culture sustained over 2 decades, not at the level of a single procurement. It does not claim that vendors involved in AIMS are the principal cause. Vendor responsibility is the subject of Case 11, forthcoming in this volume.
What it claims.
The Saskatchewan Health Authority's AIMS catastrophe is one instance of a recurring pattern in Saskatchewan public institution IT delivery. That pattern is documented by the provincial auditor at the level of aggregate project monitoring failure. The EBMP parallel demonstrates the pattern is not contained to SHA. The underlying cause is not a sequence of unfortunate technical decisions, but the institutional capability available in the rooms where the decisions were made. That institutional capability is produced by the hiring architecture. The hiring architecture systematically selects for tolerance of institutional process rather than for capability to deliver. The modernization vocabulary launders the staffing root cause, and the people paying the cost of the laundering, directly in withheld wages, are the institution's own workers.
The strongest version refuses to indict individuals and refuses to soften the institutional indictment.
The pattern is the case. The pattern is sourced. The institutional architecture that produces the pattern is observable in the public record. The choice to continue operating the architecture after the pattern has been this thoroughly documented is the choice the responsible parties are making.
Audit precision at one level.
The provincial auditor's audit of the SHA's own bedside workforce, examined in Section 5.5, shows the pattern operating with audit precision at one level of the institution. The AIMS rollout shows the same pattern operating with audit-comparable precision at the senior IT capability level. The audit function cannot directly reach. The architecture is one architecture.
7 statements. True.
Ames launched in November 2022 and was aborted in days. Ames relaunched in July 2024 and produced documented pay failures. Ames relaunched again in September 2025 and produced documented scheduling failures. The province ordered the scheduling component cancelled on the 29th of October 2025. Cumulative spending is approximately $250 million. The Provincial Auditor's 2025 report finds the same pattern at aggregate scale across provincial IT project monitoring. The Enterprise Business Modernization Project, projected at approximately $260 million, runs the same pattern in a parallel ministry. All 7 statements are true. Their relationship is the case.
The cost is paid in wages.
It is paid by the people the institution exists to employ. The institution that filtered them in is the institution that filters competence out. The modernization vocabulary is the institutional anesthetic. It is administered while the worker waits for the check that has not arrived. The case is the wage that did not arrive, and the architecture that did not let it.